We've got Jennifer Meller. She's the co-founder and CEO of Navimize. Welcome, Jennifer. How are you?
Good. How are you doing?
Come on, grab the mic there.
Thank you.
Good to see you, Jennifer. Welcome to the Startup Health Festival.
Thank you. It's been great being here so far.
Did I say the name correctly? Navimize?
Navimize, yes.
Navimize. All
yes.
right. Well, you are eliminating the waiting room. Tell me, first of all, before we get into how you're doing that, tell me about the big moonshot, the big problem that you're working to tackle.
Sure. So we're tackling access to care. So certainly waiting in a waiting room is a big problem because patients either will not come to the doctor's office if they know they have to wait and have to miss work, or they'll come to the doctor's office and leave. So that's the big moonshot that we're tackling.
Why is this something that you wanted to tackle? Why was this important to you?
Sure. So I'm a physician and I've been in practice for a long time, and this was always a huge problem in my practice. So I would see how when patients would wait and I'd run behind, that they'd get frustrated, would frustrate my staff, it would be upsetting to me. So it's a real problem. It's an even bigger problem today for physicians with patient satisfaction now being linked directly to reimbursement, with online reviews. Now patients, one bad review can really hurt your practice and your reputation. So huge, huge problem today for everyone.
This is something we've talked about for decades. I mean, it's a subject of comedians and their stand-up acts and everything about waiting in the doctor's office and what that experience is like. So I'm really glad to hear that you're working to address this. So tell me a little bit of the how. How are you actually going to fix that?
Sure. So we've created a technology platform that integrates with electronic medical records. And it pulls data straight from the EMR, so there's no interruption to the physician or staff's workflow. And we're able to actually predict delays as they're happening in real time. Then our platform takes that information and transmits that to patients in text messages, so that if you have a 2 p.m. appointment, you'll get a text at 1:30 saying, hey, the doctor's a half hour behind, don't come at 2, come at 2:30. Patients are happy, online reviews improve, satisfaction scores go up, etc. And then our kind of big picture vision is, as we expand our footprint, we're gathering data to actually figure out how to intelligently schedule patients in the first place, to really optimize scheduling and efficiencies and eliminate waits from the bottom up.
Well, it sounds like a pretty all-encompassing solution. How difficult is it actually to implement?
So implementation, actually, once we're integrated with the electronic medical record, is pretty quick. It's a turnkey solution for practices and health systems where they flip a switch and it's on. It's really more of the administrative burden of getting through the health system, getting all the parties, legal and IT and all the health systems, all that stuff, to all the parties to agree to move ahead. Once the agreement's in place, it's fairly straightforward, technically speaking.
Jennifer, I understand you had a pretty good year in 2019.
We had a good year.
Can you tell me a little bit about that?
Sure. So big exciting news for 2019 is that we partnered with Athena Health. That was our first electronic medical record integration. That partnership gave us access to their 160,000 providers and 100 million patients. So we've got paying customers, our first revenues now, and we have a couple of exciting deals coming up for 2020 as well.
How do you top that? What a great year of working with Athena Health and getting access to all those potential customers. So what do you have coming up over the next 12 months?
Yeah, so we have a couple of very large groups within Athena that look like they'll be coming on board shortly. We have some partnership deals with other companies that'll put us in multiple different health systems, and we're looking to expanding to additional EMR integrations for 2020.
That's brilliant. That's brilliant. Anything else you want to make sure that the audience can hear about your organization?
Yeah, we're excited to end waiting in the doctor's waiting room. Huge pain point for everyone. They can contact us just at info@navimize.com, and we're going to be adding a lot of exciting features as the year progresses.
Excellent. Well, they can go directly to your website. They can also find all of the companies that we're speaking to over the next 2 days by going to startuphealth.com. So I wish you a very successful Startup Health Festival and a very successful 2020.
Thank you very much.
Jennifer, thanks so much for joining me.
Nice to be here. Thank you.
Cheers.